Create a new normal. Strengthen the bond of trust between you and your delegates, creating low-risk exposure environment to work in. Redesign your conference hall in a way that your delegates feel it as safe as their home. So how do we conduct a meeting? By adopting few precautionary measures. Disinfection of entire premises, auditorium, meeting hall, office rooms with 1% sodium hypochlorite solution 1 to 2 hours prior and after the meeting. Maintain proper ventilation by keeping the windows open and preferring fans over AC. Set room temperature between 24 to 30 degrees Celsius and relative humidity between 40 to 70%. Check the health status of the delegates by sending a prior notification mail with a risk assessment form and request for their Arogya Setu app status along with recent contacts. Identify the high-risk candidates and advise them to self-isolate and seek medical care if needed. In that case, the delegate can attend the meeting by teleconferencing mode. Send a confirmatory mail with the meeting schedule and instructions to follow. Provide the delegates with private transportation to ensure safety, or provide conveyance for the same. Conduct preliminary screening at the entrance for temperature check with infrared thermometer. Request to use foot-operated hand sanitizer. Also can use sanitization mats for foot disinfection and UV scanners for disinfection of personal belongings. Face shield can be used as an alternative for mask. Entry must be prohibited without mask. Ensure contact details like phone number, email ID and the residential address of all the organizers, participants, caterers and visitors are maintained. Notify that contact details is a criteria for attending the meeting and will be shared with local public authorities if anyone is infected with COVID-19. Display posters for cough etiquettes. Maintain 6 feet social distance. Keep your mask on along with face shield and display a flow chart with unilateral path to follow to reach meeting room. Encourage use of stairs over elevator. Display a poster of physical distancing to be maintained in elevator along with flow markings to minimize contacts. Frequently disinfect high-touch surfaces like handrails and lift panel buttons. Stop at the entrance before entering a room. Use the hand sanitizer provided at the door. Likewise, repeat the process while leaving a room. In the conference halls, arrange chairs with the name of the delegates displayed, at least 2 meters apart to maintain physical distance and avoid confusion. Allocate mics to every delegate. Mic filters can be used and plastic separators can be placed between 2 delegates. Provide with foot-operated dustbins, hand sanitizer, tissues, small bottled water, etc. Ensure sufficient stock is maintained. Avoid handshakes while greeting, instead prefer Namaste. The host must brief about the safety measures, cuff and mask etiquettes in the beginning of the meeting. Avoid sharing of personal equipment and food. Lunch breaks are made feasible to avoid overcrowding. Prefer disposable plates and glasses. Ensure food trash cans are in place. Display poster of hand washing steps at all the wash basins. Periodic disinfection can be done with 1% sodium hypochlorite solution during lunch break. Frequently disinfect common rooms, washroom with 1% sodium hypochlorite solution and metallic surfaces like doorknobs, security lock, keys with 70% alcohol. Display directions of exit pathway. If any delegate experiences symptoms of COVID-19 during the meeting, isolate him or her immediately. Arrange an ambulance and initiate safe transfer to local health facilities. Inform their concerned family member and advise home quarantine to all in contact. Alert everyone if any participant is suspected or infected in next 14 days and advise for self-monitoring by recording temperature twice a day. If symptomatic, advise for self-isolation and seek medical care from the local healthcare facility or public health department by providing them details of recent travel. Maintain the records of all contact details for minimum period of 1 month. If no one is suspected or infected of COVID-19, then send an assurance email to all. In this way, with proper precautions, one can conduct a meeting with a low risk of exposure. What you do makes a difference, and you have to decide what kind of difference you have to make. So start today for a safer environment tomorrow.